Well, hello, world, and close family members, friends, colleagues, neighbors, community leaders. A lot of people have been asking recently what it means to have vaccine effectiveness or efficacy, and why we're going back to masks, and being nervous about going into the fall, and kind of having an imagination around what that might look like, and the Delta variant. And so I wanted to give you just a brief kind of report back and kind of translate this for some actionable things that you can know and some easier ways to assess risk around you. So as the virus spreads through billions of people around the world, it learns, and the parts or the pieces of the virus, those viral particles, each one of them being a virus, as they go through that wave, the ones that make it and make it the best, they're easy to be more transmitted, are the ones that continue to go. And so as it sweeps around the world, we have seasonality. So some places where are warmer, it's not going to make it as much. Rates are going to stay lower. Places that are colder, it's going to go through more, especially because people are indoors. So that means we're coming into the fall. We're coming into a period of seasonality that makes it a little easier for this virus to travel a little faster and a little further. Plus, we have pockets and groups of people around the country who are transmitting it more between them because of their social behaviors. Anything from spring break to large football games, to participating in places where there's a lot of shared air. Now, if you're vaccinated, hey, just like when we get the flu vaccine, we're less likely to get the flu. But the vaccine, it produces our body kind of more armor. And that armor isn't all of the armor that you need. It's usually for a lot of people, but sometimes it's outdated armor too. And this virus is moving so fast and with so many people that the armor that we have isn't quite enough. So it can handle so many hits from each viral particle, but after a while, some starts to get through. And so that's why we get booster shots, or we get yearly annual flu shots, because the virus that came through before isn't the one we have now. Now, why don't our vaccines just keep up with the one going through? That has to do with our eyes on the virus. And what does eyes on the virus means? It means taking a sample of those and reading out its code. And that code, they call it, the messenger RNA code, like our DNA, is what gives it the properties it has. So we're actually, if I remember correctly from when I was going through training, that 50% the same as a banana in our code. But we use our code differently so that we don't become bananas and bananas become bananas. And that's a process of systems that have developed over a long time. Just like you can kind of have a Game Boy, or you can have like a massive computer that does all this amazing stuff. But it all kind of started at the core that's the same, and that's that code. So all of that to say, what does that mean? It means that the world doesn't have enough technology around it. We have a lot of technology here in the US. Mexico doesn't have a lot of that same technology. Places in Asia and other places in Europe aren't able to process samples fast enough for all of us to have eyes on all these different little variations and changes to see which one's making it through, and then get that into a vaccine right away. So we kind of figure out what's out there, and then booster shot. Which booster shots might be coming? Why might booster shots be coming? Well, we're getting more data about how this vaccine works, and this vaccine that we have going on right now was super strong armor against the first variants that were coming through. But now that the variants have gone around the globe for a year, and especially India got hit really hard, Scotland's getting hit hard. Places in Africa getting hit hard. So that means a lot of chance for the virus to figure out which works better. So that vaccine, that armor, was really effective at first. Now might only be about half as effective 4 to 5 months later. Depends on the variant, depends on you. So if that's the case, then our armor might need kind of an upgrade. It might need an upgrade the same way your computer gets an upgrade to keep up with the latest software. So that's the report out of kind of what it means to have variants around the world, and what you've been hearing about the vaccine and what it means to be vaccinated. Now, there is a chance that people that are vaccinated won't know they have COVID infection. They have the virus infection. They don't necessarily have COVID because that's a sickness. They have the virus, and they're passing it around in their shared breath. And so what that means is we could have a lot of people who their bodies are safe being around the virus, but they're actually spreading it around. And we have kids that aren't vaccinated, and kids become vectors to people whose armor might not be strong. They might not have the upgrade. So that's a problem. So that's why we're going back into taking more safety precautions, more social safety precautions. So the next video, it's going to talk a little bit more about viral load and how that operates around you so that you can make decisions on what safety gear to use or what areas that you want to go into and things you want to participate in or not. And also how to interact with your family. And most important, how to keep your air clean, how to keep your shared air down, and how to do it safely, when to use disinfectants and things like that. So hang in and we'll do another 6-minute, 7-minute update. But again, my name is Dr. Lorelei Walker, and I am the Director of Public Health Training for the Social Safety Initiative. I founded the Social Safety Initiative, and it's grown over the last year. And now we are both preceptor sites for public health professionals who are getting certain credits, or getting certain certificates to keep up to date with things that are going on. And they are our public health trainers. And so they are coming into communities, into your community, have some simple guidebooks, have some simple trainings, and we can keep this network of knowledge going. So I direct that training program and the trainer programs that we get out to community members. You can learn more about our really awesome stuff on socialsafetyinitiative.org. The site's a little complicated right now, but we have a media page. What's more fun is our YouTube page. We'd love for you to subscribe, and that has stuff going back last year. It also has a kids corner. And our LinkedIn page is a really good place to stay up to date with what newest science news is most helpful when you're doing social hygiene. So remember, together we're going to be okay, and we'll get through this together. We're just going to spread the network of knowledge, so we're all doing it the way that works. Have a good day.